So Dr. Paul Thevenot, he is going to talk to us about opportunities in the transplant arena.
Hi, I'm Paul Thevenot from the Transplant Research Lab. Predominantly work with Dr. Ari Cohen in liver transplant, and most of our projects are either related to hepatocellular carcinoma patients that are receiving transplant or donor-derived factors that influence transplant outcomes. And so I'm going to talk to you briefly about those three studies. One of them is a prospective study that we run here through our transplant lab. And the other two are retrospective studies, again, one on HCC and one on donor outcomes. So the main study that we run through our lab is a prospective study where we're looking at ways to identify factors in HCC patients that are contributing to the risk of recurrence post-transplant. So most of the patients that meet criteria for transplant, if they're, that's based on their tumor-derived or their tumor macromorphological characteristics and their AFP biomarker. But even in that setting, patients have a pretty stable risk of 1, 3, and 5-year recurrence. And so what we're doing is focusing on different immune parameters in these patients during their waitlisting prior to transplant. And we're taking blood before and after they undergo the DEPTase or doxorubicin-eluting B transarterial chemoembolization procedure, which is part of the standard treatment for waitlist patients to bridge them to transplant. And so what we've been looking at is changes in their lymphocyte levels and how that can help us predict whether or not they have a regulatory immune response. And we've been able to correlate that with how well their treatment response to the DEPTase procedure and associated that with changes in their lymphocyte and DSC levels. And so we've recruited thus far about 83 patients for this study. And we're continuing to build patient data not related to what we're measuring in the lab. It's in order to kind of build up this risk index and hopefully be able to identify these patients that are at risk. And so there's lots of potential for us on this project in terms of exporting data and statistical analysis, as well as some different laboratory techniques such as flow cytometry, cell isolations, and functional assays. And this is, as I said, it's been our major project. We've been pretty productive on it in the past year, and we've submitted a lot of grants in this past year already for this project. The second project is based on donor factors, specifically steatosis, and how that affects patient outcomes post-transplant. So we're second site is part of a larger R01 application through Yale, where they're looking more at factors that can be picked up in the immediate post-transplant setting and then correlated back to donor steatosis. So in tandem with that study, we've been taking, for the past 3 or 4 years, biopsies of the donor liver, as well as blood post-transplant. And so in this patient cohort, we're going to focus on factors that are derived from the donor and the potential for those to help us predict patients that might have primary non-function post-transplant. So this is a rather large data set that we've already been able to use to collaborate with Dr. Garcia-Diaz and some others. And so that's another interesting one for us to potentially take on some help with. The final one is a very large study that we've done in collaboration with interventional radiology. It's kind of built upon the prospective study that I mentioned first, where we were able to retrospectively associate decreased lymphocyte counts in these HCC patients prior to transplant and correlate that with the risk of with high-risk explant findings, which is in the second panel there. With regard to lymphobascular invasion, their staging and recurrence, and then be able to also correlate that in the pre-transplant setting with their response to the DEPTase treatment. And so this study, we actually have a manuscript that's been submitted for this year, but we are in the process of converting this over to more of an intention to treat analysis, which would require a lot of assistance with going through and picking up more patients to build into that database. And so that's another opportunity for students and ours. So we have several other projects that we run through our lab that are more basic science in nature, but that's pretty much what's available for us in transplant. If you have any questions.
And all those slides are going to be available to you so that you can go through that.